consultant dietetics in the West Apollo hospitals. Extend a very warm welcome to all our esteemed speakers, participants for another Gap Year session. A global association for physicians of Indian origin is a non-profit organization which was established in 2011, long back. It aims to bring together 1.4 million physicians of Indian origin worldwide on one platform, and has presence in 57 countries, which is substantial workforce of over 1.4 million highly respected and powerful doctors. The organization is led by Padma Vibhushan Dr. Pratap C. Reddy, Chairman of Apollo Hospital Group, who is also the founder president. Welcome Padma Shri Dr. Sudhir Parekh, who is the president of Gapio, and thank him for this opportunity. Welcome Dr. Hemlata Enpodi. She is an MD Ayurveda and distinguished Ayurveda clinician with leadership across research and policies, with more than 30 years of experience, working as an associate medical director at Apollo Ayurveda Hospital. She brings together classical Kerala Ayurveda clinical wisdom and contemporary health system thinking. So she's really helped us putting this program together, and a big thank you, Dr. Hemlata. A warm welcome to all our other speakers, Dr. Jasmine Ritesh, who is a professor and head department from Parasiti Tantra, Ayurveda Studies and Research, CVM Gujarat, Dr. Lijma, the research officer Ayurveda at Sikkim, Dr. Vineet George, professor and head department at SGT University, Gurugram, Ms. Archana Venkatesh, she's a dietitian at Amrita School of Ayurveda from Kerala. So really nice meeting you all, and a warm welcome. The session today is a very important and relevant one. Samanvaya, the diet hormone integration lens on PCOS. You're all seeing plenty of PCOS these days in our OPDs. All of us can relate to this medical problem. It's well known and one of the most common endocrine and metabolic disorders affecting women of reproductive age, characterized by hormonal imbalance, irregular menstrual cycle, insulin resistance, and a lot of metabolic dysfunction. And over the recent years, the prevalence of PCOS has increased significantly. Globally, the prevalence ranges from 8 to 13%. And South Asia, particularly India, the prevalence appears to be even higher, with recent studies reporting rates ranging from 3.7 to 35.3%, of course, reflecting regional disparities. So Samanvaya today, which means harmony and integration, represents a holistic lens through which PCOS can be understood beyond isolated symptoms or hormonal markers. It's increasingly recognized as a complex interplay of endocrine, metabolic, inflammatory, and gut-mediated dysfunctions, where diet, which are high in refined foods, unhealthy fats, low fibers, bad lifestyle, and the gut microbiome collectively influence hormonal homeostasis. Emerging evidence suggests and highlights that bidirectional gut-ovary axis. We've heard a lot about gut-brain axis, but today we are understanding gut-ovary axis, which demonstrates how dietary patterns and gut microbial diversity can influence insulin resistance, androgen excess, chronic inflammation, and ovulatory health. So this aims to bring these interconnected pathways by viewing nutrition not merely as calorie prescription, but as a therapeutic modulator of metabolic resilience. By integrating dietary science, gut health, and hormonal physiology, this framework advocates a more personalized, sustainable, and system-based approach to PCOS management and women health. So once again, welcome to all, and let's dive into the fascinating world of gut-ovary axis. Over to the experts, and I would request everybody to remain muted during the session and do post your questions in the chat box. Would request Dr. Hemlata to take this forward and introduce the speakers and take the program forward. Thank you.
Thank you very much, Dr. Anita. It is always a pleasure seeing your energy and enthusiasm, how you're putting things together in place at the right time and right place. Once again, thank you so much you and the entire GAPYO team for having this session, for the thought of integrating Ayurveda into the, an attempt to bring it into the mainstream. And my dear panelists and my dear friends, today's keynote speaker, Dr. Jasmine Gujarathi. Thank you all for being with us today for this engaging dialogue, which is actually very relevant and pertinent to today's times. Like Dr. Anita was telling, it is not anymore just a hormonal issue. It is much more beyond this metabolic dilemma, which is actually grasping a wider community. Previously, I think nowadays I am getting pediatric community with the complaints of PCOD, which is very alarming. So there has been a lot of specialities in pediatrics, like pediatric neurology, oncology, or even orthopedics. Now I think we have reached a stage where we need to have pediatric gynecologists as well, for handling gynec cases especially. Anyway, it is my real privilege to have with us as today's keynote speaker, Dr. Jasmine Gujarathi. She is presently working as a professor and head in the Department of Prasuti Tantra and Sri Roga, which is obstetrics and gynecology in G.J. Patel Institute of Ayurvedic Studies. She is a very well-known accomplished academician with over 18 years of teaching experience. She is a scholar who has done extensive work in infertility and PCOD, a very successful established clinician as well. So the right person for us today to begin this discussion on the role and relevance of nutrition in the etiopathogenesis and management of polycystic ovary disease. Thank you, Dr. Jasmine. Over to you. Kindly take the stage.
Yes, thank you so much. And shall I share my screen?
Yes, please. Please
Yes.
start. Yeah, thank you.
Yes. So very, very relevant topic, as Anita ma'am and Himlata ma'am suggested, that no longer this is just hormonal condition, PCOS, but as mentioned by everyone, that it's an alarming rise which we see in our day-to-day OPD also, that starting from young girls of 15, 16 years to years, even 35, 40-year female, they come with the diagnosis of this PCOS, or many times we ourselves are very much shocked to diagnose PCOS in a 16-year girl or even in a plus 35-year female also. So very relevant, and right now it's a time to discuss about the gut health and how this dietary patterns, not only the content of the diet, but the pattern itself, it is very much responsible for maintenance of the gut health, and especially in female for the hormonal regulation or even dysregulation. So before jumping to the main thing about what kind of dietary pattern should be adopted or what researches are going on, this was a definition published by Nature journal about the what is gut health. So it's a state of normal gastrointestinal function without any active gastrointestinal disease and gut related symptoms that affect the quality of life. So it doesn't mean that only there will be huge symptoms related with the GI tract, but anything which may, even bloating itself is considered to be a major sign which indicates that the gut health is not normal. So this was which was published, and which are these key domains of this gut health. So first and foremost, which we look at, are the gut microbiome. So there will be a balanced diversity of the gut microbiome, and there should be a good index also of healthy gut microbiomes instead of the this unhealthy gut microbiomes. So even gut barrier should be properly functional. Otherwise, we all know the term leaky gut. So if the barrier function is not proper, it leaks the toxins like LPS, polysaccharides, and it causes chronic inflammation in the body. even the physiology of the gut, that is digestion, absorption, motility, secretion, everything should be properly maintained. Immune function majorly relies on the gut, and metabolism, of course, we have talked about insulin sensitivity, blood sugar, lipids, and everything. And as Anita ma'am said, that gut brain axis or gut ovarian axis also is very much now relevant nowadays for this hormonal regulation. So these are the key domains of gut health. So what are the signs of gut health? Is good gut health is regular and comfortable bowel movements, and there is no excessive bloating or gaseous distension, what we the patients tell you. Good nutrient absorption, which will be relevant by a very healthy person, active person, stable energy, with a stable energy and mood, with a strong immunity and very minimal digestive discomfort. Whereas a poor gut health or dysbiosis will be shown as inflammation, insulin resistance, will have hormonal issues, fatigue, even skin problems, and many much more. So these are the basic signs to be looking for good gut health and a poor gut health. So jumping towards the PCOS classification and how this gut microbiome and PCOS are interrelated, this is a broad or a gross classification of PCOS, which we very commonly about the phenotype A, B, phenotype C, and phenotype D, which is basically involving the role of hormones and even the morphology of the ovaries. So this is how the classification of PCOS is there. And majorly all the endocrinologists and all the gynecologists, they look, even nutritional analysts, they will look for this classification. But one more classification which we neglect many times is this one, where there is insulin resistance PCOS, adrenal PCOS, inflammatory PCOS, which is very, very important, where the gut health is concerned, and post-pill PCOS. So when we plan a treatment or we plan a nutrition, then these classification becomes very, very important to look after that if the person is having inflammatory PCOS, because if that is not being looked at and if that is not being diagnosed and we are not addressing that inflammatory condition, then major the treatment will fail either, or it will have a short term benefit only on the patient's symptoms. So this is a classification which we all should look after. And yes, this was a genome-wide association study data of more than 4.5 lakh women, and Mendelian randomization they have done, and they have shown here that how this gut dysbiosis. So how dysbiosis means when there is alteration. We talk about the Shannon index and all, where the index of the good altered microbiota has become less. So it releases this LPS, and there is decrease in the short chain fatty acids. So all this will lead to inflammation and insulin resistance. Even there is a dysregulation of the estroblome. How it causes hormone imbalance, that is by estroblome. I'm coming to that in my next few slides. Even endocrine interaction and gut vaginal axis. So not only the microbiomes in the gut, but also in the vagina also they influence and cause this menstrual disorder, and majorly it was found to be the PCOS. So this was a huge data of the genetic study which was being done, and this is just a summary related with the menstrual disorders between and relation between the gut microbiota. So as I was talking about previously, that there is even epigenetic contribution to the PCOS. That is why we get very young girls, those who are still in their teens, those who are still in the adolescent age group, why they show these signs. So first and foremost, I will not go into details of every, but you can see that first and foremost is improper ahar. So unbalanced diet. So mother herself, she is giving this burden to the unborn child, the girl child, that by eating this unbalanced food and viruddhahar and junk food, and see how this epigenetic mechanism directly leads to PCOD predisposition. So as ma'am rightly said, that very young girls also we get with insulin resistance and showing the signs of androgen excess also. So this is directly related with the improper diet of the mother also during the pregnancy. This is also which we talked about much more, that there is an evolutionary mismatch also. So why it was not present in the our ancestors, why this PCOD, hypertension and diabetes were not there? So there are so many theories which are being talked about, and one of the theories of the thrifty genes. But what we want to say here today is about the change in the dietary patterns from the ancestors to present. So in the our ancestral, they used to intake high fiber, low carb diets which supported insulin sensitivity and even hormonal balance. But now we, Gen Z, or we can say us people also, we have a tendency to eat more processed, more high glycemic, low fiber foods, and even low vitamin D. So many huge mushroom blooming of vitamin D's deficiency, vitamin B12 deficiency, and even magnesium. And this triggers gut dysbiosis, inflammation, insulin resistance, and amplifies hyperandrogenism. So this manifestation of this mechanisms is more seen in the patients with PCOS. And we can see the evidence is also, as everybody is talking about, that so many increased incidences of PCOS in this. So yes, this was what I was talking about, estroblomes. So what are these estroblomes? They are nothing but the combined genetic material of the microbiomes in the gut, which help in metabolism of the estrogens. We know that excess of estrogen, whatever is produced by the ovaries, that much is not required. So what this body do is, with the help of liver, which this estrogen conjugates with SHBG, that is sex hormone binding globulin, and then it moves on to gut, because this excess estrogen is to be thrown out of the body. So gut microbiota, with the help of this beta glucuronidase, it helps to remove this excess of estrogen from the body, which is bound with this SHBG. But this happens when the gut is healthy. But if the gut is not healthy and there is dysbiosis, and there is altered genetic material of this microbiomes in the gut, what will happen is very less estrogen which is bound will be thrown out of the body, and more will be entering back into the circulation. And we know that excess free levels of estrogen in the body again suppresses the pituitary. There will be disturbed folliculogenesis and all the signs of PCOD and hormonal imbalance, and even androgen excess will be seen. So this is how this gut axis, gut along with the hormonal axis works. And the important part which we have to understand over here is the gut health. So if everything is normal, but if the gut health is disturbed, if it is not healthy, the gut is not healthy, then it will lead to the hormonal imbalances. So this is how it happens. Okay, so there will be reduced microbial diversity, increased pathogenic species which are not necessary, which are not required, and hence it will reduce the short chain fatty acids production, which help in maintaining the all the functions and hormonal functions. Even it will disrupt the lining, as I said, that lipopolysaccharides will be leaked into the body, and this will lead to chronic inflammation. And as I mentioned, one of the classification of PCOD is inflammatory PCOS. So it might not be manifested immediately, but since long, if the person is not following the correct dietary patterns, then this will happen, leading to the chronic inflammation. And this chronic inflammation again will lead into the androgen imbalance, into the insulin resistance, and many more pathogenesis which is behind the PCOS. So yes, a very quick glimpse that how this gut microbiota helps, or if it is not proper, what it will do and cause imbalance, not only the gut ovarian, but even the gut thyroid, gut adrenal, gut insulin, and other metabolic functions. Brief review. This is so much. Even the modern gynecologist to reduce this burden of unhealthy gut. Yes, because we are Ayurveda scholars, so it will be not justified if we don't talk about the Ayurvedic concept. So we all know that we believe that all the diseases, they begin from the udar. Okay, So that is abdominal diseases due to vitiated vata kapha, including agni mandya. So rogaha sarvapi mandagni, this everybody knows, sutram udarani cha. So all the diseases, they origin from the udar, that is the abdomen, or we can say that the amashaya or grahani, and mandagni is the foremost cause. So if we correlate it with the modern, even dysbiosis, irritable bowel syndrome, or leaky gut, what is happening in the pathogenesis of the PCOS also, it has been mentioned over here. Even sroto rodha, which cause altered intestinal permeability, vata dushti, especially apan and saman, which affects both digestion and menstrual function in the, because they are in the same anatomical zone, and the pakvashai sthan, that is the HPO and gut brain axis, they intersect over here. So very minute, if we can say that it has been talked about in our classics also, and which we see right now also, which is relevant in this era. So if we see one of the pathology of the gut microbiota, estroblome in PCOD, so dysbiosis, altered estroblome, estrogen disturbance with increased estrogen levels, free estrogen levels in the blood, leading to the PCOS features. And from the Ayurveda point of view, starting from the mandagni, leading to the ama formation. So even because of this ama formation, there will be obstruction and inflammation of the artha-vahasrotas, that is all the channels, causing the formation of vikrut ahar, vikrut ras dhatu, which is not properly formed, and hence the vikrut artava formation. This is, we can consider the hormones and even the menstrual function, everything will be disturbed, and the sole cause here from Ayurveda point of view will be agni mandya or mandagni, what we say. So of course, though PCOD is talked as kapha vataj vikara or kapha and vat, these two doshas are more involved, but we have to consider that vata, pitta and kapha, all the three doshas are somehow behind the pathogenesis of this PCOD. And you can see over here that not only the vata function, but kapha and pitta also, in the form of ama association, pitta association, all are behind the etiopathogenesis of this. So again, detailed, if we can consider it from the Ayurveda point of view, impaired digestion and metabolism with formation of the toxins and absorption of free these toxins in the body, causing the gut dysbiosis and inflammation, again leading to kapha and medha dushti, that is insulin resistance and obesity, and pitta dushti in the form of hormonal imbalance and excess of androgen, causing ovarian dysfunction. And clinically, we see the picture of PCOD, which is manifested in the form of anovulation, irregular cycles, cyst, and even infertility, which is again a huge burden nowadays. So many times we discuss about the lean PCOS and obese PCOS. So now, no longer now it's an issue of obese patients only showing the signs and symptoms and pathology of the PCOS patient. But even we get a lean PCOS who has a very normal BMI, she's not overweight, she's not obese, but still she is showing all the signs and symptoms of PCOD. So what was being talked about this is that they also have the pathology of insulin resistance, as well as there is a problem with the brown fat activity, brown fat metabolism. So this brown fat, it is said to be very much necessary to improve the insulin sensitivity, glucose utilization, and lipid metabolism. So unlike this white fat, even brown fat in lean patient also, it is being altered. Okay, so there is improper distribution of this BAT activity, and this really increases the insulin resistance and even increases the androgen levels. So why I am talking about this is, remember mandagni. So here it is said that certain herbs and certain food like moringa or berberine or curcumin, they have done patent also of this curcumin on this, that it will activate this brown adipose tissue, so that the metabolism, so agni, deepana, pachana, all these medications, how they will work on this brown fat also, and it will help in the brown adipose tissue metabolism and its lipid metabolism and its function also. So this is again a brief overview about association between gut dysbiosis and PCOS. Everybody knows, and it's a brief overview what I have talked about till now. So coming to the treatment aspect. So again, not the treatment only, the dietary aspect. So what all the data, meta-analysis, which was done in the recent time, it suggests that the first line of treatment for all the PCOS condition, whether lean PCOS or obese PCOS, is lifestyle and nutritional therapy. So they suggest that this is the first line, and you can see that in 2024 itself, a network meta-analysis was done, and what they said is DASH diet, that is dietary approach to stop the hypertension. So this diet emerged as it was used for hypertensive patient, but it was most effective for reducing the insulin resistance, even fasting glucose, insulin, triglycerides, and even fasting insulin. So this is a meta-analysis from various research projects which were done, even low calorie diet, and along with the medication, what they have added it is metformin for the insulin resistance, low carbohydrate as a top for weight loss and lipid improvement. And second important was ketogenic diet. We know there are controversies about this keto diet, and many nutritionists, they now say that it is also harmful. But under observation, it had shown that a very short-term approach on specific individuals with this ketogenic diet may report significant reductions in the LDL and triglycerides, and even testosterone and insulin resistance, and improvements in the FSH and menstrual outcomes. So this is for the first line of therapy, and you can see over here that they are also highlighting on the dietary patterns rather than the medication. So what is this DASH diet about? So dietary approaches to stop hypertension, where they emphasize more on fruits, vegetable, whole grains, legumes, low-fat dairy, lean proteins, nuts or seeds. Why they are used? Because they are very low in sodium. It is rich in fiber, potassium, magnesium, and even antioxidants, where the oxidative stress is very much more in PCOS patients. So what these trials they had done on PCOS patients also, they show that it had 8 weeks on DASH diets. It led to, so hardly 2 months, greater reductions in weight, BMI, insulin, triglycerides, and even VLDL compared to the control diets. So this encouraged them that yes, this kind of diet should be more implemented in the patients. So also it had improved insulin sensitivity, reduce the inflammation also, and better blood pressure control. So it supports the hormonal balance directly via the metabolic improvement. And of course, there is a fiber role in estrogen metabolism. We know that good fiber diet will again help in the maintenance of the gut microbiota. So another dietary again which is having controversies is a ketogenic diet, which is very low in carbohydrates but moderate in protein and high in fat, which induces ketosis, what for burning the fat in the body. So what does this has effect on gut dysbiosis? So as I said, it is mixed and time dependent. So there is ketone bodies formation, which is having anti-inflammatory effect in the gut. And short term, as I mentioned previously also, short term shift to this diet may help in reducing the inflammation, but long term concerns remain regarding the reduced microbial diversity and lower SCFA production, short chain fatty acids, which is not needed over here, which is not required in PCOS patients. So of course, as I said, short term but not long term. So this is a menu for DASH diet versus a keto diet. So what can be given to the person for the entire day? So of course, we Ayurveda people will say that so much of eating should not be done for obese patients or but this is a very much research based dietary protocol which is being used, and clinical trials have been conducted. But as I said that again, individualized, which we talk about again later on, individualized approach should be formed for each and every individual. So this is what, starting from morning, this is a DASH diet and this is a keto diet. I will not go into detail of this. Warm water with lemon, dalia, guava, or few almonds, and multigrain roti, palak dal, or roasted chana, green tea, or khichdi with spinach or gourd can be used, and warm turmeric milk. versus this is a keto diet with the warm water. And you can see over here paneer burji because protein is needed, walnuts and zucchini, avocado smoothie, palak paneer with coconut flour and even turmeric almond. So this is how whole menu which can be given to a personal individual and customized diet. So what are the benefits and drawbacks of these two? This is high fiber, of course, sustainable and heart friendly, but here there will be drawback is that there will be a slower weight loss as compared to keto. So we need to convince the patient that yes, this may happen. It is not aggressive enough for severe insulin resistance. But the keto diet benefits are that rapid weight loss will be there, and it has a anti-inflammatory effect also. But main drawback, it reduces the gut bacterial diversity and beneficial bacteria. So even lower fiber, I have said that it causes more dysbiosis. So it is harder to sustain this treatment, this kind of diet for a longer time, and requires a very careful monitoring. One more diet nowadays, which is very much seen in the celebrities also, and even the patients also, they come to us that they seek anti-inflammatory diet because everybody is talking about inflammation nowadays, and we have seen that PCOD patients, they have this as a classification inflammatory diet. So it's a way of reducing or eating a focus on reducing the chronic low grade inflammation. So it is not just a single dietary pattern, but an eating pattern that emphasizes whole nutrient rich foods while avoiding the processed and pro inflammatory diet. So this is a kind of anti-inflammatory diet. So here you can see what includes this anti-inflammatory diet. So colorful vegetables, you can see leafy greens, berries, even tomatoes, broccoli, spinach, and cruciferous vegetables. I'm coming to that once again. Healthy fat, you can see over here olive oil, avocados, and whole grains also in the form of oats, brown rice, and millets, legumes, herbs. Uh, don't forget to add this Indian spices in the food, especially those who are suffering from this PCOD, because they are good anti-inflammatory and they prevent this gut dysbiosis. Even fermented food, which are very much good for the gut dysbiosis, green tea and herbal tea. So all these are considered to be the anti-inflammatory diet. Yes, I know that Ayurveda people will say that fermented food are not anti-inflammatory, but because in moderation, they may improve the gut microbiota. So that is why they are considered to be good in the inflammatory condition. Yes, this was what I wanted to talk about. The what they have mentioned is previously uh, cruciferous vegetables. So these are the cruciferous vegetables, but we have to be very careful while implementing this in all the PCOD patient, because many times the PCOS is secondary to hypothyroidism, or even the patient is having PCOS and hypothyroidism simultaneously. So in such patients, this diet should not be given. Cruciferous vegetables, these are all the cruciferous vegetables: broccoli, cauliflower, cabbage. They are very much rich in goitronomes. This will alter the goiter function, the thyroid function. So it has been contraindicated in patients with hypothyroidism. So of course, if the thyroid values are normal, this can be given. But if the patient is having PCOS along with the hypothyroidism, then it is better to prefer these vegetables which will not alter the thyroid or goiter function or the goitronome function, that is spinach, methi, which is fenugreek leaves, bottle gourd, rich gourd, zucchini, carrots, beetroot in moderation, cucumber, green beans, pumpkin, and drumstick leaves. So we have to be very, very careful while addressing the diet of this. So always I say that managing a PCOS patient should be a multidisciplinary condition. Only gynecologist or only dietitian or only a physician, all of them should come together and then plan a diet, a treatment, and metabolism and everything for an individual patient with PCOD. So this is how we should be careful while giving the diet. Yes, these are the evidences, research-based evidences, that how and which dietary intervention has led to improvement in the presentation of the PCOS patients. Very quickly, low carbohydrate, low glycemic index diet, high protein diet, all they have shown very, very encouraging results, not only in the symptoms, but also in the glucose metabolism, in the insulin resistance, and much more. As you can see over here, also low fat, fatty acids use, even MUFA enriched diet, DASH diet, plant, even not only such diet, meals per day compared to 3 meals per day, and they have shown very encouraging results in the insulin sensitivity and even the meal timing. So all are these evidences which focus on that yes, diet is a first line of management in any patient with PCOS, and not only in obese PCOS but lean PCOS also, because we know they also show with the insulin resistance. So yes, coming again, how to collaborate both the sciences, the nutrition science and the Ayurveda dietetics also, because what Ayurveda says that diet is not only about the food articles or the food content, but what are the various other things, what is the Ayurvedic dietetics about, talk about. So simple, which is easily digestible. Again, it will vary from individual to individual, which should be small in quantity. How much small in quantity? So it is said that 1/3 one, I will come to that. And food according to individual's capacity. So it is not necessary that each and every person will have a same kind of one bowl for each and every person. It is unlike that. There are certain rules for the preparation of the food, that how it should be prepared, method of ingestion. Just a moment. Hello. Hello.
Yes, request you to try and close it fast so that we have time
Yes.
for the panel discussion.
Yes, yes.
Through your slides, yeah, please. Thank you.
Few more slides. Give me 5 minutes. Okay, am I audible?
Yes, you are.
Oh, yes, yes. Okay. So there are rules for consumption of water and rules for eating the food. So this is what the important rules of Ahar Vidhi. So how to consume what kind of food, warm, freshly cooked, which stimulates the Agni. So it should always include a ghee, a cow's ghee or oil, which helps in the lubrication and digestion. Always it is mentioned in Ayurveda that snigdha mashniyat, always the food should not be very dry. Matravat, it in proper quantity, as I mentioned, 1/3. After only the previous meal is digested. Eat mindfully. Mindful, it is again a new topic which is being talked about much more in a calm place, sitting down without any distraction, which is what we do always. Proper order and combination. So always start with a sweet taste in a small amount and avoid the incompatible. So eat according to season, time, and prakriti. One's body constitution is what the Ayurveda dietetics talk about. So yes, always who will remain healthy, who will not contact any diseases. So first thing which is mentioned in our text is hitahar vihar sevi. Always a person who is indulging in the regular or healthy diet, they will remain healthy for always and not contact with any other diseases, along with other factors, of course. So it's a timeless tool for Agni protection and microbiome support. So warm, fresh, and mindful eating will promote beneficial bacteria and short chain fatty acid production while reducing the harm, that is the toxins. So key home message is prioritize the gut health as a first line strategy. Individualize the care based on phenotype, prakriti, and comorbidities. Integrate wisely, combine the evidence-based DASH or low GI or Ayurvedic principles also, probiotics, symbiotics, and stress reduction, of course, and target herbs for optimal outcomes. And yes, these are the challenges. Heterogeneity in PCOS phenotypes, every individual is not same. PCOS patient is not same. So personalized approach is necessary. We have to bridge, which is what we are talking about today, the dietary patterns, the gut microbiome science, and the Ayurvedic wisdom. We have to bridge these patterns and move beyond the symptom management and toward the reversal of pathogenesis. And future research are needed, much more needed, on the personalized microbiome modulation and integrative protocols. So this I highly acknowledge the Global Association of Physicians of Indian Origin, and Anitha ma'am and entire organizing team, especially Dr. Hemlata ma'am for contacting me and giving me this opportunity, all the panelists, all participants, and all researchers whose research I have quoted. So thank you very much.
Thank you very much, Dr. Jasmine. That was a very all-encompassing, vision on all aspects of, dietary as well as metabolistic aspects of the etiopathogenesis and management of PCOS.
Very well explained. Thank you.
Thank you, ma'am.
Yeah, Hemlata, Dr. Hemlata, you can take the panel, please.
Right. Thank you, Dr. Anita. And once again, my gratitude to Dr. Jasmine. I hope if you can, remain and take a few questions. Dr. Anita, do we have time for taking a couple of questions if we do have?
We can have her with the panel only. She's here with us. Yeah.
Right. Okay. So now let us get ahead with the panel discussion today. I hope all the panelists are ready. Welcome all panelists. It is such a privilege. I am not able to see, is Ms. Archana available?
Yes, Dr.
Yes. So once again, welcome to all the panelists. It is really a privilege. Am I audible and visible?
Yes,
not visible. We can hear you. Just check your camera, please.
Okay.
Yeah, good. Oh, it went again.
Right. Okay. I hope it's fine. Yeah. So, my dear friends, let's get on with the most interesting and lively part of the evening. Let's have some deliberations on various dietary aspects. First, we will look on to the causative, the etiopathogenesis of PCOD. We will have some Ayurvedic insights as well as some research insights with some integrative aspects of integrating the traditional wisdom and the modern nutritional science concepts. So we do have with us a very varied, diversified panel. First of all, we do have Dr. Vineet with us. Dr. Vineet George is a very distinguished professor, academician, who is heading the Department of Sanhita Siddhanta in SGT University, Gurugram. He has been a clinician as well with very sound background of clinical practice of, I think, 3 generations, right from Kerala to Delhi. He has a lot of clinical experience as well. So welcome, Dr. Vineet, as the first panelist. Then we do have with us Dr. Lijima. Dr. Lijima C. She is a research officer with the Regional Research Institute of Ayurveda, Regional Ayurveda Research Institute in Sikkim, Gangtok, all the way from Northeast. She holds a doctorate in Ayurvedic Stri Roga Prasuti Tantra, which is gynecology, from the prestigious Gujarat Ayurveda University, Jamnagar. And she has some very credible work done on, I understand, PCOS in her studies. So welcome, Dr. Lijima. We are looking forward to hear you also. And to complete the panel, we do have Mrs. Archana Venkatesh. She has been bridging her nutritional science, academics, and clinical background currently for the last 3-4 years at Amrita School of Ayurveda as their chief dietitian. So she has been working on her PhD in Ayurvedic dietetics under Dr. P. Ramanohar as well for the last couple of years. So we again would be very interested in listening to your takes in bridging modern nutrition concepts and Ayurvedic dietary concepts. So let's start with Dr. Vineet George. Dr. Jasmine has very interestingly described about how acne mandya, the bad dietetics or Vishama Viruddha Ahara in Ayurvedic terminology, slowly leads to Manda acne or metabolic disruption, leading to inflammatory conditions, which in turn leads to PCOS. So similar concepts have been explained in Ayurveda, which Dr. Jasmine was also explaining, where Viruddhahara leads to Mandakni and Ama, which cause the base, the stratum of all metabolic disruption. So Dr. Vineet, can you please ground us about this classical understanding, Ayurvedic understanding, as to how these dietary nidanas, especially where we talk about, like, Guru Snigdha Vidahi and all, Viruddhahara and all, initiate the samprapti of PCOS, specifically focusing on this Agni Mandya, Ama formation, leading to Meda, Artava, Dushti. Over to you.
Thank you, Dr. Hemlata. I think it is audible to you, right? Okay, so
yes, you are.
Thank you for the opportunity. And I think Dr. Jasmine has very evidently and clearly explained about the concept of PCOD in Ayurveda, and she had in a nutshell provided the details also. Basically, as per the understanding, a healthy reproductive system is always assessed by the intact uterine adnexa and also the hypothalamo-pituitary ovarian axis. And that is normally considered to be a healthy healthy reproductive system. And as far as we are concerned with the recent studies, they very specifically say that the nutrition is the key to maintain a healthy reproductive system and for any associated disease conditions also. Ayurveda, as it has been told very rightly, we have Agni Mandya or the impaired digestive fire as the cause for any disease, especially for PCOD. In the present situation, we can consider this. I can just in 1 minute, I can tell you what I understood from the classics and what had been deciphered is actually, along with Ahara, there are many things which we should consider, which can be the Vihara in the present states, which can be the activities. Vihara refers to activities, the lifestyle modifications, the lifestyle changes, in which Ahara and Nidra is also a parameter. Nidra refers to sleep patterns. So the improper sleep patterns is one of the most predominant causative factor which we should understand, which is hampering the healthy reproductive system, and we have to be very cautious about that. Ahara, when we consider about Ahara, obviously to Ahara, I can just go in 1 second. Before that, we need to think about the Bija Dushti also. Bija Dushti refers to the genetic predispositions. When we can understand about primary relations having the same reproductive disorders happening in the present generations, really indicates that there is a connection between the genetic predispositions. We need to think about Pradushta Arthava Dushti also in a very, very serious matter, because we know that in the present generation, where Staulia is considered to be Staulia obesity, obviously, and it leads to the peripheral conversion of androgens in the adipose tissue, which again increases the medu dadu, which is considered to be the fat. So along with Ahara, we need to think about Vihara also, the activities. Nidra is a parameter out of which we need to think about the genetic predispositions. We need to think about the Bija dosha. But when we consider all this, out of this, Ahara is the highlight. Food is the highlight. So what can be food and what happens is actually a bigger parameter to think about. We can think about Ahara as such. When we go before Ahara, there are 6 stages of disease manifestation, as we all know, the Shadkriya Kala. In the Shadkriya Kala, what we can decipher is actually Agni Mandya is the key, and that is considered to be the accumulation phase, which is actually the primary phase. Agni Mandya refers to impaired digestion. From there refers to the second phase, which is actually an aggravation, where we get to have most of psychological parameters, which will be referring to alasya, which can be the gauravata of the thoughts, which can happen over there in the phase of aggression or dosha avastha. We need to think about prasara, or the stage where there is actually rapid spread, where actually most of the physiological changes start to exhibit, like Guru Gatrata, heaviness of the body, which is exhibited over there. We need to think about the localized sthana samsraya, where actually we get to see PCO, or we can get to have endometriosis, or we can even think about polycystic, staulyada or obesity. And at the end, we need to think about the complications or we consider as bheda or complication, where we get to have endometrial carcinoma, diabetic mellitus, or hypertension, and all those things. So in a very small nutshell, I can say ahara, vihara, the genetic dispositions, the pradushta artava, all these factors which can manifest in the 6 phases can produce the disease of PCO, which is not mentioned in Ayurveda, is the most important thing, which we don't have. Vagbhada rightly says, Vyadinam Nama Akushala. There is no problem without naming a disease. So we can say it can be in verified formats. We can understand that it can be Grandhi, it can be a Kafaja Medoroga, it can be anything, but it should be highlighted that Ahara is the key and Agni Mandya is the cause for this, Dr. Hemlata.
Yes, very correctly said. It doesn't zero down to just having some good or bad diet. We talk about the 3 pillars of life, Ahara, Nidra, and Brahmacharya, basically. So this Ahara is the first part where, you eat well, you build your body, and you sleep well, you scavenge your body. And after eating well, and then after taking away the toxins away from the body, you can prepare the body well, so that the 3rd pillar, where abrahmacharya normally refers to the sexual life, which in turn reflects the reproductive health. So if you have the ahara, the nidra, which you very correctly mentioned, and the 3rd upastambha, which is the reproductive health, these 3 can be tagged along in the same line for maintaining a good progeny and for maintaining good reproductive health. So thank you, Dr. Vineet, for emphasizing that it is not only the ahara. And again, we talk about ahara vithi vidhanas. How to eat, not what to eat, not just what to eat is important. We always talk about various dietary rules as to how and how much. So thank you for that insight. Now, moving on to a little research insights. We do have Dr. Lijima here. So Dr. Lijima, from an integrative research perspective, do the emerging scientific insights support parallels between this AMA and metabolic inflammation? So Dr. Jasmine was very correctly speaking about the metabolic origin of this inflammatory PCOS, which needs a lot of attention, because nowadays the inflammations, whether it is even autoimmune conditions, where inflammations are the key to, Dr. Vineet was mentioning, from just the inflammatory stage to a cancerous stage. So inflammation is a ruling condition in many of the cases of PCOS. So how can you just integrate between AMA and metabolic inflammation, or what the insulin resistance in the context of PCOS?
Thank
How
you,
do you see? Yeah, please.
Okay, thank you, ma'am. Actually, I thank Dr. Jasmine, ma'am, who is the role model for every juniors like me. Thank you, Jasmine, madam, for this wonderful presentation. Actually, madam has explained everything in detail initially regarding this initiation, the causes, and ma'am has also included some of the research aspects also regarding RCTs, reviews, etc. Bringing about the correlation between modern and Ayurvedic aspects. So I have I don't have some much more thing to add, but I just try to add some few points. Actually, we know that PCOS is a lifelong metabolic endocrine inflammatory condition. So the current trend is that the role of inflammation is highlighted more in PCOS rather than just some hormonal imbalances alone. When we see the cause of PCOS, actually in Ayurveda, the PCOS as such is not described as a single entity, but different other conditions such as diseases like arthavakshaya, etc., can be incorporated under this PCOS. So while seeing this nidana or this causative factors of this artava dushti or this yoni vyabhat or the gynecological disorders, the first thing mentioned in our classic is mithyachara, which includes mithya ahara, mithya vihara. So ahara is the first main causative factor, or the mithya ahara, wrong this diet, is the first causative factor of PCOS, which is equally accepted by all the acharyas of Ayurveda. That means ahara is the sole cause, it is the initial or the first cause of PCOS or any gynecological disorders. And as madam has told, roga sarve abhi mandakno, which means mandakni or the impaired digestive fire is the cause of all diseases according to Ayurveda, in which acne means it is the collective metabolic and digestive power responsible for transforming food into energy and tissues. So from a modern point of view, this acne can be correlated with enzymatic activity, mitochondrial efficiency, and proper nutrient oxidation, etc. So this impaired acne can be taken as disturbances in enzymatic activity, disturbance in mitochondrial efficiency, and impaired nutrient oxidation. So ama is produced after improper digestion. So what actually ama is? Can be considered as a physiological state of inefficiency in digestion and metabolism. So we can say that Agni can be one of the initiating factors of this metabolic syndrome, initiated by mitochondrial dysfunction, impaired lipid and glucose oxidation, leading to excess free fatty acids, inflammatory cytokines, and reactive oxygen species, which are the main role players in the genesis of PCOS. So we can say that this Agni Mandya can be correlated with metabolic inflexibility and mitochondrial dysfunction. Then AMA, that is the toxin which we say, it can be considered as inflammatory metabolites, endotoxins, oxidative stress. And ma'am has also told about the Srodhoroda, that means blockage of channels. So this Srodhoroda can be considered as insulin resistance and impaired insulin signaling. And along with this concept, we should add the Medo Dushti also, that is impaired lipid metabolism. So, and we know that impairment in adipose tissue or the accumulation of adipose is one of the main initiator of insulin resistance, leading to PCOS. So these correlations are supported by researches done on chronic inflammation, insulin resistance, gut microbiota, and oxidative stress. So this not only it is initiation of PCOS, but this can be seen through the treatment aspects also. We can say that the treatment of PCOS includes Langhana, Deepana Pajana, Shodhana in a nutshell, even though it is personalized. So this Langhana, we can take it as intermittent fasting. Then Deepana Pajana, it can be caloric restriction and adding high phytonutrient content, etc. Researchers have proven that this Langhana, Deepana Pajana, Shodhana can enhance mitochondrial function, reduce oxidative stress, and can surely improve insulin sensitivity, which is the prime treatment aim in PCOS. Along with this quality of diet, the timing of meal is also important, as ma'am has told. In a cohort study conducted, it has been shown that in two groups of individuals, the total caloric content were same, but the difference between the PCOS patients and the control was that the timing of the meals were irregular, but the total caloric content of both these groups were similar. That means it throws a light on the proper or regular timing of meal in combating this PCOS. And rightly, ma'am has told about the behavioral dietetics also, the code of conduct which we should follow while eating. It has been strictly mentioned in Ayurveda regarding the quality of food, quantity, that is Ushnam, Snigdham, Matravat, etc. has been mentioned. This aligns with the chrononutrition in modern aspects. That means that timing of meal mentioned in Ayurveda aligns with the chrononutrition described in modern aspects, where we can say that the insulin sensitivity is more during day compared to night. So better to avoid late night meals. That is the main thing which can be followed in dietetics. And ahara is not just a cause. We can say that ahara is not just a cause of PCOS, it is a cure of PCOS too. The same thing becoming cause and cure is wonderful. That means ahara has a great role or the big role to play in initiation and also combating this PCOS. And also, researchers have shown that time restricted eating, that means it is a TR, it's shortly called as TRE, time restricted eating. That means, for example, we can say that we can have food between 1 p.m. to 7 p.m. For the rest of the time, we should just have light diet, with less calorie food and plain water, similar to fasting. So this time restricted diet is mentioned in modern. So we can also incorporate it with Lenghana, that is intermittent fasting can be correlated. So rightly, as ma'am has asked, the research insights throw light on the correlation between Agnimandia and metabolic inflexibility, AMA and inflammatory metabolites, Srodhoroda or insulin resistance, Medodushti or adipose tissue impairment. So these are some of the correlations, but large or wide range of randomized controlled trials are needed to further prove all these aspects. Thank you, ma'am.
Excellent, Dr. Lijima. That is very true, because you focused on the points Srotoratha, which in Ayurveda we believe that Srotas is one of the most important factors in the etiopathogenesis of all diseases, especially Uttarotara Dhatu, when we reach the latest dhatus like reproductive dhatus and all, definitely you have to consider the Srotorotha. That is the channels have to be opened and patent, so that the proper metabolism. See, Srotas are nothing but the metabolic channels. So when you say that when ahara is consumed in a wrong way, definitely the intended metabolic compounds or the molecules, the target metabolic molecules are not formed, which has to form the fuel for the next metabolic process. So this chain reaction of what the previous theory, free radicals, which are seen as amas or toxins, which completely vitiates the internal environment. So it very beautifully it converges the modern concept with the Ayurvedic concept of ama and Agnimandia. Now, thank you, Dr. Lijima. And now we have Mrs. Archana Venkatesh with us with some clinical nutrition reality. Ms. Archana, bringing this concept into clinical domain, from your experience, what are the most prevalent dietary patterns that contribute to an alarming increase in the PCOS of today's young generation? Over to you, Archana ma'am.
Thank you, Dr. Hemalata, for this question. And I really appreciate Dr. Jasmine, who gave us such a comprehensive presentation, integrating both Ayurveda perspective and modern perspective. It really was a very, very elaborate presentation. And also adding on to the other two panelists, specifically answering to the question that is posted to me. So as a child, I belong to the 80s, right? So when I was in my school, maybe like around 5th standard, 6th standard, mid 90s is what I'm talking about. That's when my school used to get all these packeted items, as a part of their marketing strategy. All these instant cooking noodles and so many things, They used to just come freely distribute to our schools, and I have enjoyed eating all of that. And I have had so many biscuits, so many ultra processed foods. I think that is one major thing that has increased over time. Sugary drinks, beverages, basically the madhura rasa consumption in our day-to-day diet has really surged with the inclusion of ultra-processed foods in our diets. That's one major thing. The second one is, I would say, is bakery items, where they use refined flour, again, very predominant in Madhura Rasa. So rice itself, which was actually a staple food for all of us from long back, is not the culprit. But I think it's an addition with so many things, and the sedentary lifestyle, which we cannot neglect, because I think we belong to a very agriculture, we are ancient ancestors might have had agriculture as their occupation, which required standing in the heat and doing all this work, meticulous work under the sun, right? So I think rice was a very supportive ingredient for such a work. Whereas now we are just sitting on, and then we are munching on top of all that we eat. We are also having all these ultra processed foods, ready to eat, instant. Even instant oats, for example, can give a very high sugar spike. So that's the problem. That is the dietary shift that we are seeing now. Like, always we see sugary beverages being consumed. We are looking at the bakery items and the fried items being consumed. These are the major culprits. So sugary beverages also includes your tea and coffee with sugar, added sugar, right? So you have to think about all of these things and make a note of it. And so what is the real shift from the traditional diets that we have? That is very, very, very important. So that answers one question. And I've always been fascinated about Shatrasa concept of Ayurveda. If everybody could consciously think, if they are experiencing all the 6 tastes in their food, that is something very interesting, not quantifiable. Unfortunately, it's pretty hard to quantify that. But if you look at the food groups, the cereals and milk are predominantly having only sweet rasa. The pulses and legumes incorporate sweet and astringency in them. The nuts and oil seeds have sweet, bitter, and astringency, incorporated. Fruits and vegetables by far are able to cover all the rasas except for salt, maybe, which is anyway added in our food, right? And then you have yogurt and cheese and curd, which are more predominant in sweet sour combination. When there is not much of sourness, the fermentation is limited, it's a bit sweeter, right? And then we have meats, poultry, and eggs, again coming in the sweet taste. So our Indian diets are so diverse in the use of spices, etc. So we have a fantastic traditional cuisine which can actually support us. I think it's the ultra processed food which is the major culprit, because what I've seen is, when you have convenient food at your disposal and you are hungry and you start getting used to it, you start thinking of those foods and then you get hungry for it, right? So I think that has been a huge shift. And then you're not thinking, and these foods are very cheap. You pay 10 rupees, 15 rupees, you get a packet of biscuits, it doesn't even fill you. You don't think about it. So behavioral adaptation and conscious choice of food is a huge challenge these days. So this is exactly what I wanted to add on to the current discussion. I hope it helps. Do you want me to talk a little bit more, or?
Actually, Archana, it will be very interesting if you can throw a little light into, we do have some questions regarding, probiotics and, adding the dietary patterns which you would recommend with your integrative experiences, how we can integrate these, what we call, we do have anna samrakshaniyam, speaking about the vat pit kapha and the rasa basis of all the dietetics, and on the other side the nutritional science capsulize these nutritions into our dietary pattern. So can you just throw a little light into
Yes.
how you can integrate these both for in the context of PCOD?
Okay. So basically, what I feel is, as I already mentioned, the Madhura Rasa content of our food is increasing by far because of all the ultra processed pressure cooking. Like the traditional methods of cooking rice was, you will discard the starch, you will boil the rice in excess water, and you discard it and you consume that rice. So when we look at personalized nutrition, some of the continuous glucose monitoring observations, pressure cooked rice would give a more sugar spike as compared to something that you do, when you boil and you discard the starch. And there is also this concept of resistant starch these days, which is a bit contradictory to what Ayurveda might say. Because it's not fresh. We are asking you to cook rice and then rapidly cool it and then take it, which becomes more guru for us. Like you will yourself find the difference when you eat freshly cooked rice in the morning and you just leave it, and you eat the same rice in the evening. One is the agni is not as good in the evening for all of us. The second is this kind of rice does have an impact. Like immediately we feel a little fuller, isn't it? So it's the context in which we have to use these ingredients becomes more relevant, because for a healthy individual it's different. For a PCOS, we are making it very specific, in application to try and deal with their current situation. So that Madhura Rasa is a huge thing to be looked at. If I look at a patient's diet and the recipes that they are taking in, if I'm finding too many things that are contributing towards Madhura Rasa, that's what is alarming for a PCOS individual, along with all the other things, of course, but only specific to the Madhura Rasa of that particular thing. But that has so much of contradiction with proteins also, because as we say, eggs are also Madhura in nature. So if you ask me about this whole protein aspect of modern nutrition, I would really want to put it under scrutiny with respect to Ayurvedic principles. I'm not against it, but I have my questions around it for an Indian context, because somehow we are not able to take in so much of protein. I don't think.
Also, comparing keto diets, and throwing light into the utility of this kind of
Yes.
diet. And thank you, Archana ji. I would like to move on to a quick second round, if time permits. What is the call, Dr. Anita, or shall we?
Yeah, so let's also address the questions. In fact, I'm getting them on my personal chat. I don't know, they're not able to put them there. So can we address these also side by side, and then you can see how...
Yeah, that will be better then. I think, can we address the questions now, or shall we move on to one round of questions more?
If they're quick and brisk, let's just take the points and make it risky.
Yeah, I think we can take up a few questions and then direct it to some specific panelists if where it suits.
Can you see the questions in the chat box?
Yes. Okay, so this is again, do you advise probiotics, and which one?
Should I take this one?
The first question, yeah, it will be over to you.
So these questions,
advice probiotics, you were just about to mention the same.
So probiotics, there is no specific strain that would, of course, the general thing that we say is the lactoacid bacillus group, bacteria group. But besides that, probiotics itself, there is limited evidence. There's no strong evidence, its effectiveness in general. But it is being prescribed. It does help certain individuals. Of course, it does help, but it's not very strong compared to
So the
diet.
question specifically, which one? We normally are very apprehensive in using dahi.
Yeah. LAB in form of takra is also good enough. LAB is lacto acid bacillus, lactic acid producing bacteria, basically Saccharomyces, etc. Greek yogurt,
So maybe
for
we
example.
can say that, like, maybe takra, which Ayurveda considers to be very likhu and ushna, and it is a good metabolizer also. So maybe if you just want to choose one probiotic, I think it will be a good takra, which is not very sour.
Absolutely.
And with which has always been the favorite of, it can be likhu and pachana and ushna. So maybe that answers that question, I understand. And next question, I think I would direct it to what types of ahara are considered to be kapha aggravating and should be restricted in PCOS? Good question. Dr. Lijima, will you be able to throw some light into what kind of kapha aggravating food can cause PCOS specifically?
Okay, ma'am. Actually, we know that the main causative factor of PCOS is basically it is kabavardhaka ahara. So it can include mainly the dairy products like cheese, ice cream, this high fat milk, etc. Then along with that, the sweeteners such as white sugar, cane sugar, etc. Then
very true.
Okay. Then much oily foods. Then this nowadays we can say this pizza, everything. They come under kabavardhaka ahara.
Kaphavardhaka and Vishyandi aharas specifically need to be avoided in the case of PCOS, I understand. PCOS. Normally in the clinical practice, Dr. Lijima, I remember we discussing about, like, avoiding 4 Fs. Fermented, fatty, frozen, and fried.
Yes.
All are kabhavardhakas. So remember, we can always tell our patients also this 4 Fs to be avoided and 1 F to be taken, which is fiber.
Okay.
So I think that answers that question. Now, if you had to give one key dietary recommendation for PCOS patient, what would it be? One key dietary recommendation for PCOS. Is Dr. Jasmine around?
Yes, ma'am. I'm here.
That you will be the best person to answer that question, I think, of all of us. What is your take on that?
One key I won't say, but what I suggest to my patients is only 3 meals a day. I restrict them to only 3. Breakfast, which should be more in rava items, what I suggest them. So it will be low calorie. And a meal, lunch, which will be very much less in rice and as well as wheat. As Archana madam also suggested that they are the culprits nowadays to be told us. So less wheat and less rice in the lunch, and dinner should be very light, and the meal should be very timely. So one should not have time for meal which are very much irregular. So regular pattern of these 3 meals is very, very important, and low calorie diet as much as possible, not kapha aggravating. So next question that they have asked is, like Lijima ma'am also answered, what are kapha aggravating foods? So those foods should be restricted. So this is my own main key recommendation, what I tell to all my PCOD patients, not more than 3 meals. Nothing else should be taken in between. So that is my key recommendation, what I will suggest.
Excellent. The next question is, what is the importance of meal timing in regulating hormones according to Ayurveda? I think we do have Dr. Vineet here. So meal timing.
Yes.
We were talking about ahara vidhanas. So timings of the meal, like you said, the circadian rhythm and the metabolic rhythm of the body. So what is your take in that?
With regard to meal timing, basically, I have one concept which basically strikes my mind whenever we speak about diet intake and the food restrictions and all those things. It all depends upon the digestibility. Of course, I every time say the same thing. It all depends on digestibility. Ayurveda every time says that it's on digestibility, and the second thing is on satiety, or we call it as tripti. So Ayurveda Ahara are of two types, which is heavier and lighter. It all depends on that. So a heavy diet, whenever you take a heavy diet, you have to go, you should never go beyond that satiety level. It should be like Artha Sauhitya. It says that half of your digestion or half of your tripti, and I mean half of your tripti, specifically half of your satiety. And when you're going for a lighter food, you should not cross that satiety level. So meal concepts is right. You can go for the three meal, which Dr. Jasmine Madam has rightly pointed out. But again, we have to stick on to the digestibility, which is again varying for person to person. So rather than prescribing a particular diet to anyone, it would be good enough to individualize the concept of food, rather vary it according to the Prakriti variations. Think about digestibility again, because matra is the concept. Matra is the quantity or posology. Matra is dependent on dravya, as Ayurveda says, matra dravyani apekshante, and matra is agni pravartaka. So it again induces the agni also. So these three concepts we have to keep. Obviously, again, to the point of probiotics, I really think that curd would be in this context, because my question pointed was a little different, but still deviating from the question, I would say curd would be a little different to be served in a PCOS. Obviously, not at all in nighttime. That is totally nishidha. Takra would obviously, as stated by Dr. Archana and Dr. Hemalata here. Curd, I don't find, because I was finding it in the question chat box. I don't think curd would be better enough, because it is a kapha medo roga. Again, Vishanti or Ushnatva would not be suitable for in this particular case. And I believe Annakala is always depending on the digestibility of a patient rather.
Yeah, I think the next questions which have come are all in alignment to the things which we were discussing in Ayurveda. How can modern dietary science like insulin resistance management be aligned with Ahara principles? I think we have already mentioned regarding that. Dr. Jasmine was mentioning the same. Which fats are good to use? Which is the best time to take water? Seed cycling.
Yeah, so these questions came in my WhatsApp. So
Okay. I think half of them have been already been answered. Dr. Jasmine spoke regarding how to manage the insulin resistance and the modern dietary principles. She has very clearly explained in terms of the properties of the diet as well as the menu itself. So that itself was answering to that question.
One question about milk was there. So again, it's a controversial thing. Milk, according to Ayurveda, we know that it is okay. But nowadays we say that milk is also pro-inflammatory. And there is a lot of talk about A1 and A2 milk. Earlier A2 was good enough, but now again there are concepts that A2 also inflammatory. So cow's milk, if possible, if it is available, genuine, fine. Even cow's ghee is also good as a fat. Also, somebody was asking what fat should be consumed.
Which fat?
So yes. Both these can be consumed and should be consumed, because many of our patients, we tell them to just take 1 spoon of ghee in the warm water. So that also helps a lot to such patients. So I think these two things should be taken note of. I personally, I stop milk for all PCOS patients, and it improves a lot.
Basically, again, when coming to milk and the use of milk and ghee, previously the quality of the milk and quality of the ghee which you used to get is totally different from what we are getting now. So the milk being inflammatory, I think in villages where we raise cows with the local natural food and all, that may not be a problem. But the processed milk and the processed ghee may be a problem. Am I right, Dr. Jasmine?
Very true. Because what we get in the thalis, plastic bag, they are pro-inflammatory. They are not milk at all. I suggest they are not milk at all. So
that's very true.
For me, I stop. But even if it is possible for them to get the cow's genuine milk, then it's okay. And with turmeric, as I mentioned, that never forget to use this functional foods. These are Indian spices, because Agni, where what we talk about metabolism and Agni. So for that, this Indian spices works miracles, and they should be added. So Sesame oil also can be used in the form of fat. Coconut oil, many times in South also they use that. So I think these fats will be okay. And cow's ghee if available.
It's a very, very good question which I'm seeing here. In your clinical experience, how effective is Ahara Vihara correction alone before starting medication? That's a very good and relevant question. I think Dr. Lijima and Dr. Yeah, Dr. Jasmine, yes. Please continue.
Yes, because I see daily, I have 7-8 patients of PCOD with all age groups, and this is very, very important. If they do not manage their diet and lifestyle, none of the treatment will work at all. So we have to, and there was even a research on that for 1 year, and then after 1 year they started with the therapy. So for me also, I do the same thing. Yes, I start with 1 or 2 medications along with their diet and lifestyle. If they are not following, I tell them, don't come to me if you don't want to follow the proper diet. So this is very necessary.
Exactly. Yes. Dr. I think we all do that way, especially in adolescent and young girls. We always start with, I prefer to start with only dietary modification, exercise and yoga. These are the things which normally I start with in my practice. You correctly said that, without this, no medicine is going to work. Don't come to us just with expecting some medications. Excellent.
So there was a question on seed cycling. There was some research on using flax seeds and sunflower seeds and then recycle to pumpkin seeds. So what is do you also use it in your Ayurveda? Seed cycling, pumpkin seeds, flax seeds?
No, ma'am.
Okay.
I personally don't use that because again, for everybody, it is not relevant, this seed cycling. And even flaxseed, I tell for thyroid patients, and many times we see PCOS comorbidity, hypothyroidism is present. So flaxseed is not to be given to them. Even soya is not to be given to them. Oatmeal should not be given to the patients with overweight or high BMI. So my personal experience, I don't use this. Instead, I give them that ajwain and black sesame seeds, and they can use this, even shatapushpa, that is dill seeds. They can use this in the combination as a daily in the form of mukhwas, what we say after food. That can be taken. But my personal experience, I have limited on this seed cycling, ma'am.
Why only
the concept of mukhwas, which she told, and the use of dill seeds again. So the many of the seed cycling, again, a few seeds, but the Ayurvedic concept of seeds are totally different from today's dietary concepts. So we use these kind of things as Deepana Pachana Dravyas basically, and these dill seeds can be used as a substitute for medication. It is very much estrogenic, if I understand it right, Dr. Jasmine, isn't it?
Yes, it contains phytoestrogens. It balances this.
Exactly. So the concept there is ahara can be used as a bheshaja. The question was regarding where we can start with the dietetic restriction before going into the actual bheshaja paddhati or the medicaments. Ayurveda strongly believe in ahara being used in place of aushadha for the metabolic correction in the initial stages, where the dosha imbalance is at a very minimal stage. And if it doesn't cross multi-dhatu centric, adjusting your diet is the first line of management in across all systems of medicines, I understand, and Ayurveda emphasizes it all the more.
Archana has a hand up. Archana, please add.
I just wanted to add one thing that people can include very comfortably in their diets is the gourd variety vegetables. They have a great cleansing effect on the body in general. And that's why it also increases the fiber content of their diets. So any which way, if you can just incorporate more gourd variety like your Loki, your rich gourd.
What we call the watery vegetables.
So what people were doing was just taking it raw juice. Is that advice? Or would you want to
juice rather than juice? Make them a sabji and eat it. Like all the gourd varieties, using it as some form of sabji. Don't, remove the fiber and throw it away. So,
Don't peel it.
I mean, no. Peeling is okay. That is fine. But, cut the whole thing and make a proper sabji and so that the insulin response is much more. I think juice is okay for people sometimes, but if the digestibility is too low, I think soups are better.
But it was very much in vogue, I think a couple of years ago. First thing in the morning.
Having the ash god, especially.
Can I add something, ma'am?
Yeah.
Can I add something, ma'am?
Yeah, please.
Yeah, please.
Okay. So I am just adding to Hemda madam's concept of this ahara being aushatha. Actually, regarding this gynecological disorders, our Acharyas has mentioned some patyas, that means the wholesome food that can be taken in Yoni-roga or gynecological disorders. I'm just adding 3 things. They are tila, yava, leshuna. Tila means sesamum indicum. Then yava, that is barley or hordeum vulgare. Leshuna or garlic. So the researchers on these 3 drugs are truly amazing. That means this tila, it targets both the endocrine signaling pathway and this ovarian health also. Studies have shown that in PCOS, this tila restores LH-FSH ratio, reduces testosterone and increases estradiol. And the histopathology or the animal studies have shown that this tila have shown a reduction in ovarian cyst size and has improved follicular development also. Then this yava is considered as a superfood. As Jasmine madam has told about the Regisella parigeria, that means the regimens which a girl or a woman should follow during menstruation. The one dietary thing mentioned by our Acharyas is yava or barley. It is a superfood because it has exceptionally low glycemic index, and this high fiber intake is related or associated with increased ovulatory cycles and reduction in androgens also. Then coming to this leshuna, it's also mentioned as a wholesome food in general gynecological disorders. So clinical trials have shown that this intake of garlic have shown this reduction in insulin resistance also. So these 3 can be considered as diet as well as medicine also. That's all, ma'am.
That was an excellent tip. Yes, in Rajaswala Paricharia, very interestingly, we had a question of milk. In Rajaswala Paricharia, Acharya, the first diet Acharya asked you to take is milk only. Shaireyam yavakam stokam, which is yavakam means yava, which is barley, and stokam, it has to be taken only in little quantity. And Koshta Chodhana Karshanam has been told that because this has to be in very less quantity so that lankhana has to be achieved. So again, this come back to the concept of Srodorotha, which even Dr. Jasmine was highlighting. So basically speaking, if you want to have a dietary control over metabolic disorders, specifically regarding obesity or regarding this PCOS or even diabetics, what you have to first adopt is reducing the glycemic index of taking less glycemic index food, eating in lesser quantities, like taking maximum 3 meal. Dr. Jasmine was suggesting 3 meal. I normally suggest only 2 meal a day. Again, if the patient is obese. Again, for lean patient, it is totally a different regimen. Mostly I suggest actually only 2 meal and being very consistent on the timings, the portion size, and also the right combination of various diets. There is a very good concept of yushas in Kashyapa Samhita, which is an excellent dietary guideline for all the diseases, specifically for metabolic disorders. So if any Ayurvedics are there, you can refer to this Bhojana Kalpa Adhyaya and Yusha Kalpas. Some 27 yushas have been told. All this can be incorporated in your patient's diet for the dietary management, for both preventive aspects and also for the management while giving medicines. Please make sure that you are giving a dietary prescription on the sides of it with clear ahara vidhanas, that is methods of taking diet, the timings, the combinations which are very important, the Viruddha concept have to be taken in mind, and there are clear list of aharas. Ms. Archana also would be dealing with this, which can be advised for daily use. There are some things which are strictly instructed to be avoided, like for dahi, for taking curd, there is an entire big sloka which indicates the timings, the combinations in which it can be taken, the seasons in which it can be taken, the time of the day when which it can be taken. So there is a lot of dietary restrictions on taking dairy food even. So I think with this,
I think we really short up in time, but it's so interesting. I think we could go on and on to understand our concepts, which are so different from yours. We just
very true.
We talk of proteins and we talk of other nutrition, but they're very nice to learn the other aspects of things. Thank you so much. I think we can close. You think that's...
Move on to the conclusion.
Yeah. Yeah. Conclude and then you can, I can wind up. You want to conclude it with the last message?
Yeah, I was just finally again, like we have been talking for this 1.5 hours. It is not just that, like, ahara is a peripheral thing in food, is not peripheral to the causative or the management. It is very much very much a part. It can be as good as a prescription, and without which the prescription is not complete. So it is entirely central in the causative or management of diseases of metabolism like PCOS. Thank you very much.
Totally agree with you. Totally agree with you. And a big thank you. We'd like to first say a big thank you to the President, GAPIO, Dr. Sudeep Parekh, and the organizing team of GAPIO for this very big opportunity. And to you, Dr. Hemlata, for putting this all together for me. Thank you so much. And thank you to Dr. Sushil Jain for all the help and guidance. Big thank you to Dr. Jasmine, Dr. Lijima, Dr. Vineet, and Ms. Archana for your very excellent and enlightening talks and inputs. Learned a lot from you and a lot of take-home messages from all of the participants. Really grateful to all of you for accepting this invite on a very, very busy day, on a weekday especially. And thanks the IT team and Jitinder for all the support. And of course, the participants for making it interactive. All the questions came from there, which I put from the other group here. Thank you. Thank you, everybody. Thank
you. Thank you very much for all the organizers.
Thank you, ma'am.
GAPIO.
Thank you.
Thank you, everyone. On behalf of Doplexis, a special thanks to all our faculty members and all our presence today here for your valuable contribution throughout the sessions. Thank you so much, everyone.
Thank you. Bye-bye.
Bye.
Thank you.
Bye.
Thank you. Bye.